Welcome back. Due to this poor connectivity last time, we are not able to continue the session. Now we are continuing the same session with the IMNCI. On the last, we discussed about which are the diseases are not covered into the IMNCI. Basically, we discussed the problems related to the birth. If children having any congenital anomalies, that is not covered into the IMNCI. If there is any home accidents are there, that is also not going to be covered into the IMNCI. If there is a trauma or emergency situations which is occurred, that is also not going to be covered into the IMNCI, as well as newborn basic care regarding to the LBW baby is there. So these all condition, LBW baby, small for dead baby, so these all are the basic conditions which are not going to be covered into the IMNCI. So basically we can say the IMNCI cover the disease condition which we are able to treat at the home level or whether at the PHC or CHC level. If there is any condition above to that, so generally we need to refer that particular client to the next chain or to the next hospital, so that the child will get an appropriate treatment for the same. Now in continuation of the same, now we are going to be talk about the principles of IMNCI. As I have already explained to you, basically we classify the age group into 0 to 2 months and then 2 months to 5 years. So here again principle of IMNCI are based on the same protocol. So the first principle it's saying all the sick young infants age up to 2 months must be examined for the sign of possible bacterial infection. Basically the bacterial infection is the most important condition in IMNCI, because whatever the disease happen to the children, that is because of the bacterial infection. So this is the case where we need to identify what are the possible bacterial infections present into the children, and here we also are going to be identified general danger signs. Basically this is the children those who having a less than 2 months of age, and if it is above to 2 month to 5 year age, so then again we need to identify whatever the appropriate cause or where the bacterial infection causes are there, and according to we have to do plan for treatment. The second principle, all the sick children must be routinely assessed for the symptoms. So all the symptoms has to be recognized properly, like there's a cough, difficulty in the breathing, diarrhea, fever, ear problems. So these all are the very important symptoms through which we can identify the correct disease condition. So this is also one of the important components. This is considered as the principles number 2. Here we need to identify if child suffer with the diarrhea, if child having any disease condition, if child having convulsion, if child having a jaundice. So these all the condition has to be recognized into this phase. Next is third principle. The third principle is telling they must also be routinely assessed for the nutritional and immunization status. All the child must be examined for the immunization, because immunization history is very important for all the children. So we can recognize whether the child has taken all the immunization or all the vaccines appropriate or not. If the child has not taken any vaccine, then we can invite the child to the PHC or CHC or sub-center, so that the child can get the particular vaccine on that point of time. The next principle is that assessment of vitamin A supplementation and deworming status of the children, especially between the age of 2 months to up to the 5 years. So because this is the school going age where there will be chances of getting the worm infestation among the children. So that's the another principle of IMNCI which is play very important role into that. So this is a very important component into the IMNCI. Now next we are going to be talk about what are the specific conditions which we are going to be identified when the child age is less than 2 months. So the first condition is we need to keep the child always warm. So we need to give the same suggestion to the mother, always the mother should keep their child warm. Second point, initiation of breastfeeding. As soon as a newborn deliver, within 1 hour the mother has to be advised to start the breastfeeding to the newborn, so that the child will get appropriate feeding at the time and the child will get the energy. So that is one of the important component. Counseling of the mothers for the exclusive breastfeeding. During the same time, a nurse or a nurse educator can give the advice to the mother or parents that breastfeeding is very important, what are the advantages of breastfeeding and how it will be very important for the child. So that one counseling session can be conducted for that mother. Next is cord care, skin care, eye care. These all the basics care has to be provided to the children. Next is recognition of illness in a newborn and its management. If there is any abnormalities are present at the initial phase, so a nurse or a doctor has to be identified that case at the initial level, and then the immunization. All the immunization has to be given to the child on an appropriate amount of time. So these are the some of the important component when the child age is less than 2 months. So basically two important component. One is that maintenance of the temperature of the child, then immunization, which is one of the very important component, and the continuous breastfeeding and giving and counseling to the mother. So these are the 4 or 5 points which is very important when the child age is less than 2 months. Next two is that when the child age is between 2 months to the 5 years. So when the child age is between 2 months to 5 years, so basically we can say here we are going to be cover the infancy, toddler and preschooler age. So these three age we are going to be collect here. So into that particular case, what are the important components that has to be covered into the IMNCI? One of the important is management of the diarrhea, management of acute respiratory infection, management of malaria, management of malnutrition, identification of anemia. These all are the important conditions that has to be identified at the initial phase, so that we are able to give an appropriate treatment at the time. Next is recognition of illness. If a child having any illness, it might be acute or it might be a severe, so the child has to be identified, or whether a doctor has to be identified what type of problems a child having. Next is prevention and management of iron deficiency, which is most of the important component, because this will later on it will leads to the anemia. And then vitamin B12 deficiency. If a child suffers with vitamin B12 deficiency, that has to be recognized at the initial phase. The same counseling for the feeding for the malnourished children. A mother has to, means a nurse provide a proper counseling to the mother regarding that their child is malnutrition, and if the child require extra protein, or the child require an extra diet, or the child require an extra energy to recover that malnutrition. And the next is immunization. So these are the very important component when the child age is between 2 months to the 5 years. So overall I can conclude, whenever we are going to be talk about the treatment phase, or whenever we are going to be identify the client problems, so basically if the child age is less than 2 months, so 4 important component. One, maintenance of the body temperature of the child. Second, appropriate initiation of the breastfeeding. Breastfeeding means continuous breastfeeding is one of the most important component. Counseling to the mother, and then care of eye, skin and cord. These are the some of the important component. When the child age is between 2 months to the 5 years, so that time we need to identify the bacterial infection into the child, that we need to identify the malnourished case is there, acute respiratory infection is present or not there, if the child suffer with the diarrhea, child having a convulsion, child having a jaundice, that all the thing needs to be identified at the initial phase. If child having vitamin B12 deficiency, that has to be identified. If child require any what we can say, the child require any iron deficiency condition, that also recognized at the initial phase, and provide a proper counseling to the mothers regarding to the malnutrition child. So this was the one of the important component into that. Now in continuation of the same, which is one of, I can say, this is the one of the very very important component of IMNCI chapter, which is considered as IMNCI case management process, because everything is depend on this case management process later on. Because here is the only condition: firstly we receive the client, then we are going to be assess the clients, then we are going to be classify the client into as per the color coding, whether the red color, pink color, yellow color, or whether it will be a green color. Then we are going to be classify the child, and what will be the next protocol for the treatment. If the child undergo with the red color, so what will be the treatment protocol? If child undergone with the yellow color, what will be the treatment protocol? So that's why we can say this is the very key component into the IMNCI, which is considered as a IMNCI case management process. Now just listen me very carefully. So first is basically it is an outpatient health facilities. Imagine as soon as you received a client, or as soon as you received a complaint from the mother that their child is not able to suck properly, whether the child having the child is not able to get an appropriate weight as per his age. So these all the important information a nurse must be understand properly, a doctor has to be noted it properly, so that it will give us another indication what are the problem for child. So in the same sequences, first check for the danger signs. As soon as you get an information from the parents, firstly we need to identify what are the danger signs which are present into the danger signs. Means generally there is any history of convulsion, the child suffer with the convulsion or not, if there is any episodes of lethargy, if there is any episodes of unconsciousness in the children, if child ability to drink the things properly or not, if child is getting the proper breastfeeding or not, if child having a complaint of vomiting or not. So these all are the key indicator which will give us an appropriate information about a particular client or about a particular child, because on the basis of that only we are going to be further identify. Imagine if a child is not able to get a proper breastfeeding, it can give us an indication that yes, the child may be malnourished. If there is an episode of a convulsion, it will also give you another indication that yes, this child having some neurological problems. So through that we can say yes, if a child having a continuous vomit, so then we can say yes, this may be case of diarrhea or dehydration. So according to that we need to identify the clients. In the next step, assess the main symptoms. So whatever the information you are collecting from the parents or from their guardian, so and then they are providing you the information, you need to ask some more information. That will be cough, if there is a presence of difficulty into the breathing into the child, there is a presence of diarrhea or not, if a child having a fever, since how many days a child is suffer with the fever, have you measured the temperature of the child or not, if a child having any ear ache is present, if child having an ear problem is there, if there is a presence of ear discharge, that all the point has to be noted very properly on a documentation, so that it will give you the further information. Next, into the case management process, assess the nutrition and immunization status. Immunization status has to be assessed properly, as well as the nutritional status of the child, because it will also give you some of the information. Imagine if a child age is a 9 month or 10 month or 11 month, if a child is not getting the measles vaccine at an appropriate time, so the child may show some of the symptoms of the measles later on. So that's why the case histories play very important role here, and as well as the feeding problems. If child suffer with any feeding problems, means poor sucking reflexes are present, child is not able to store the things properly. So this all the information is very important, and then ultimately check for any other problems. If other than this, if any other problem is there, that also has to be identified properly. So this is also one of the case management process. Along with that, now you have collected, now this is the phase where you have collected some of the information from the parents, like whether the child is getting proper breastfeeding or not, the child has received proper immunization or not, child have a history of convulsion or not, child suffer with the jaundice or not. So this all the information you have covered. And now once you receive this all the information, now on the basis of this information you have to be follow a IMNCI protocol, and accordingly that you have to be classify the child into the different color code. Basically 3 color codes we have already discussed. One is a pink color, a yellow color and green color. So on the basis of the severity of the symptoms, imagine child suffer with convulsion, now it's a danger sign. So here we are directly, without giving any other complication, without receiving some other information, directly we need to cover to the child into the pink or red color, because it requires an emergency treatment for this particular child. If you received some of the information, child is not sucked or child is not getting a proper breastfeeding due to the poor sucking reflex, now this is the a sign where it may be happened due to the poor breast attachment of the child, mother using inappropriate position for giving a breastfeeding. So these are some of the things which is not considered as a dangerous. Here you can classify into the green color, where some home remedies you can give on, and then you can giving some of the counseling to the mothers, and then you can treat this particular condition. So that's why it will goes into the green color. Imagine the child suffer with the diarrhea. Now when child suffer with the diarrhea, we need to ask some of the information from the parents, since how many days the child having this complaint, when the child passing the stool, so what type of stool, it is a loose stools, what is the frequency of passing the stools, if there is a presence of any blood into the stool or not, because it may be a problem of dysentery later on, it will be very severe condition now. So then we need to classify into the red color. But if the severity is less, there is no presence of blood, the frequency of passing the stool is less. So this will goes into the yellow color, whether you can recover through the home remedies, or whether you will give some of the treatment to the child at the local level, and then you can recover the child. So according on the basis of this all the information, we need to classify the child, which is very very important. Once the imagine you have identified the child and you classify the child into the home management. Now in a green color, home management. So what you need to do into the home management? So we can say a caretaker is counsel, means whatever the caretaker is, whether maybe father or mother, we need to give a proper counseling to them. That will be regarding to the giving oral drugs, how to give oral drugs to the child. Treat local infection, if there is any local infection is present, how to treat, we need to give this counseling to the parents. Continue feeding, how to give a breastfeeding, what is the appropriate attachment, what is the position of a mother, what should be the position of a child during the breastfeeding. This is also one of the very important components. And then last one is a follow-up. These all comes under the green color. But when you classify the child into the yellow color, so what you need to give? So when you identify the child into the yellow cover, then you have to be give a proper treatment, means of the local infection. If a child having any local infection, we need to give a proper appropriate treatment for the local bacterial infection. It might be we can say there will be ampicillin, cloxacillin, or some of the antibacterial drugs which is available at the local level. We give oral drugs, so we need to give an oral drugs to the child, so the child can recover himself. Advise and teach the caretaker. Again we are giving some of the teaching methodology, some of the teaching tips, or some of the advice, or some of the suggestion to the parents or caretaker. And the last one is a follow-up. So the difference between green color and yellow color is that at the green color you can give a suggestion at the home level. You have no need to giving any such important drugs to the client. But in the yellow color, definitely there is a requirement of some of the drugs. Some of the drugs is really very important in this case. We have to be given some antibacterial drugs to the child according to his age, and then we can suggest for the follow-up. But when it will goes into the pink color, so again it will be considered as a referral, or it will be considered as a disease condition which is not able to manage at the local level. So that in that case we have to be provide a referral to that particular client along with their parents. So when they are moving from this local level to the next level hospital, so that time a lot of information we need to give to the client or their parents. One is pre-referral treatments. Whatever the basic treatments is required, we need to give at the local level. Advice to the patients, and then we are going to be refer the child. So here when referral facility, firstly we have to be given a triage and treatment. Next is a diagnosis, treatment, monitoring and follow-up. So from local level you have transferred the child to the next hospital. So the next hospital role is there, they must identify the diagnosis of the child, what is the exact problems of the child, and then once they identify the child diagnosis, then they have moved with the treatment. And then last one is monitoring and follow-up. So these all are the very very important things which is present into this IMNCI. So case management process is very very important into the IMNCI. Through the case management process we can cover rest of disease condition. It might be local bacterial infection, it might be a convulsion, it might be a jaundice, it might be some other problems which is present into the children's. So that's why this is very very key component and very important condition or protocol that we must understand about it. I hope you are able to recognize it. For your information, when you are dealing with this lecture or this session, please go through the picture, or please go through the IMNCI case management process module or an image, so that you will get a more clarity about whatever I am going to be talk about in this session. Because the important component is a classification of a disease or child. It will be yellow color, pink color, or whether it will be into the green color. So according to that we are going to classify. So I hope you have enjoyed this session. Thank you to listening. Thank you.